Yes, we are live on YouTube. Hello, welcome to the IPA-UNICEF-WHO webinar on adolescent and mental health during COVID-19. I am Amruta Vadnekar, working with IPA India office. On behalf of IPA, would like to thank you all, the speakers and viewers, for gracing this webinar. Now I am requesting Dr. Jonathan Klein for the opening remarks.
Thank you, Amruta, and good morning, good evening, good afternoon, everybody. I'm John Klein. I'm a member of the IPA's Executive Committee, and on behalf of IPA President Dr. Errol Alden, I'm delighted to welcome you to the fifth in our series of webinars on child and adolescent health during COVID. This is part of a series addressing a variety of issues that are affecting children and adolescents and their families. I'd like to especially thank Dr. Naveen Thakur, the IPA Executive Director, and IPA's staff in the India office, Amruta Vadnekar, and Kitty Devari, and Shraddha Udakar for all of their excellent logistics, organizing, and social media work. We have several upcoming webinars in the schedule, both in English, Spanish, and French, including one coming up next on on do no harm in the newborn and perinatal period, which will also involve some USAID colleagues. And that one will be followed by a webinar on school opening and policies and what we as child health clinicians and policymakers can do in that area. Today's webinar is on adolescent and mental health, and we have a great panel lined up today. Our moderators are Dr. Susan Sawyer from Melbourne. She's chair of the IPA's Strategic Advisory Group on Adolescence and also president of the International Adolescent Association for Adolescent Health, and Dr. Anshu Banerjee, director of the Department of Maternal, Newborn, Child, and Adolescent Health and Aging at the World Health Organization. I'd like to remind all of the participants that you can enter questions for the panelists either into the YouTube or into the Zoom chat box, and we'll be lining up as many questions as possible for the panelists, and hopefully they can address all of the questions that come in the next hour and a half. I'd also invite you to subscribe to the YouTube channel for the International Pediatric Association in order to make sure that you get notices for some of the upcoming webinars. Let me now turn it over to Dr. Anshu Banerjee to take us away into the webinar. Anshu, over to you.
Thanks a lot, John, for this introduction. And I'll be moderating this session together with Susan. But maybe just a few comments. I think we're living in extraordinary times at the moment. And this COVID pandemic has really given us an example of, or a situation in which we have to cope with situations that we never thought that we would be earlier. And we already knew that, of course, mental health was causing a large or making a large contribution to the burden of disease, particularly when it comes to disability-adjusted life years. And I think the COVID pandemic has shown us how important this actually is for adolescents. I think it is really highlighting how mental health impacts the life of adolescents. And for example, the issue of school closing, what the impact has been. The impacts of school closing has had several impacts. First of all, for example, on the nutritional status of adolescents, for those who rely on school meals. It has also, of course, worried adolescents in the sense of their educational outcomes and whether they will be able to continue their education the next year, but also whether they will be able to find work afterwards. It is, of course, also related to the economic impact. And I think also to the violence against children that has increased during the COVID epidemic or pandemic. And so looking at this, putting this all together, we thought it would be important to have a webinar dedicated to the issue of mental health and adolescence in relation to the COVID pandemic. So I would like to introduce the other speakers. First of all, Susan Sawyer, who, as already mentioned, is the who's the president of the International Association for Adolescent Health and leads the special advisory group on adolescent health for the IPA, will give a background to mental health. This will then be followed by a presentation by Omnia El-Omrani and Joanna Lai, a joint presentation. And Omnia El-Omrani is the liaison officer for public health issues for the International Federation of the Medical Students Association. And Joanna Lai is the technical focal point for adolescent health and well-being at UNICEF and supports programming amongst adolescents related to mental health, NCD prevention, school health, and adolescent pregnancy. And they will look at sort of what adolescents feel is important for them in relation to what has happened around the COVID pandemic. We will then have a presentation by Colleen Kraft, and Colleen is the professor of pediatrics at the Keck School of Medicine at the University of Southern California, and works also at the Children's Hospital in Los Angeles, and was the past president of the American Academy of Pediatrics. And she will describe 3 case studies, very different from each other, how adolescents have actually responded or dealt, or what the impact was of the pandemic on them. And finally, we'll have a presentation by Tarun Dua, who is a pediatric neurologist and leads the brain health unit in the Department of Mental Health and Substance Abuse here in WHO in Geneva. And she will talk about the response and examples of how we have been able to provide guidance in relation to how to deal with the impact on mental health in adolescents within this pandemic. So the speakers will hand over one to the other after they have each spoken. And after that, we will go into the Q&A session. So I hand over to Susan for the first presentation.
Good evening to you all. Okay. Over the past few months, all of our lives have been upended, and many of you will have experienced great personal losses. Given the scale of upheavals to our professional and to our personal lives, a daily diet of media like this is certainly enough to engender distress even in the most robust. The impact on adult mental health is already apparent. And at the end of only the first month of the lockdown, for example, a survey of 10,000 Australian adults showed a 2-fold increase in the rate of clinically significant depressive and anxiety symptoms, thoughts of self-harm and suicidal ideation. The most vulnerable adolescents in that survey were those who had lost jobs, lived alone or in poorly resourced areas, were providing care to dependent family members, were members of marginalised minorities, women, or aged 18 to 29. So what about the impact on young lives? As we've heard about, the world has changed for them as well. In addition to living with increasingly stressed families, massive school closures with inadequate learning support at home, social isolation from friends, lack of access to sport and recreation pursuits means that young lives have effectively been put on hold. In this webinar, we'll be reflecting on the implications of this for young lives. But let's start by reminding ourselves that mental health conditions develop early in the life course, are common, often persistent, and have been hugely neglected relative to their prevalence and impact. As is now very well appreciated, half of all cases of mental disorders develop by 14, 3/4 by the age of 24, although most remain undetected and untreated until later in life. In high-income countries, A high prevalence of mental and substance use disorders has been consistently reported in national adolescent health surveys. For example, in 2012, the US National Comorbidity Survey found the point prevalence of any DSM-4 disorder and diagnosis in adolescents was 23.4%. There is every reason to expect similar, indeed, if not higher rates of mental disorders in resource-poor settings, but a high proportion of low-income countries have no baseline data about even the most common mental disorders like depression and anxiety. Different disorders emerge at different developmental periods, and my apologies for my attempt at trying to show this across the life course of infancy through to adulthood. Some are apparent in terms of their onset in infancy and early childhood, shown in blue and orange, with many more arising peripubertally to feature in adolescence or later adult life. Delayed diagnosis and treatment is concerning, as the immediate and long-term adverse consequences on an individual's life and life outcomes, on an individual's health and life outcomes, can be profound. And the significance of this is that many are preventable. Using 2010 model data from GBD, Holly Erskine and colleagues showed that mental and substance use disorders accounted for a quarter of all disability in 0 to 24-year-olds worldwide. A quarter. I think we just need to reflect on that. Here, the left panel shows the disability adjusted life year rate per 100,000 population for different conditions. The authors modelled a set of 20, but they show the leading 10 here, with the panel on the right showing the contribution of different disorders by prevalence of the total number of DALYs. On the left, broken down by age, you can see that these blue arrows highlight the extent to which the DALY rate increases with age across childhood and adolescence. Whilst on the right panel, I've shown these arrows in blue to indicate the most prevalent condition, being depression, and in purple, anxiety. So two key messages from this slide. The most common mental disorders in childhood are anxiety and depression, and that the prevalence of these increases dramatically with increasing age across adolescence. So what about COVID-19? You only have to have a quick look at this list of modifiable risk and protective factors at different ages, taken from 92 systematic reviews, to appreciate the anticipated harms. Risk and protective factors are mediated through relationships within families for children and adolescents, and particularly then at schools, through context such as financial stress and poverty, and through physical environments, whether they are safe or not. I've circled here the protective factors and would invite you to reflect on how these might be changing across the pandemic. For example, recent studies suggest that at least a third of parents have little confidence, and this is employed parents, have little confidence about their current employment, with financial worries being a major contributor to poor family functioning. So, no surprises that early surveys of children and adolescents already suggest much higher rates of loneliness, sleep disturbance, irritability, difficulty concentrating, all harbingers of future anxiety and depression. We developed this diagram for the Lancet Commission on Adolescent Health and Wellbeing in 2016 as an attempt to show that adolescence is the most dynamic period in the life course in relation to changes around these sort of common social role transitions, you might call them, but basically the proximal social determinants of health in terms of the transition from family of origin to family of one's own, shown in the purple swathe across the bottom, the transitions between education and employment, and then the relative impact of peers and also media, shown here functioning as a uber peer, if you like. Before the pandemic, we were already tackling a learning crisis, with 53% of children in resource-poor countries living in what the World Bank calls learning poverty, that is, unable to read and understand a simple text by the age of 10. And in a recent paper modelling the likely impacts of the pandemic on student learning, the bank suggested that without drastic remedial action, there will be a huge setback to the goal of halving the percentage who are learning poor by 2030. Additionally, Past recessions demonstrate that young people bear the brunt of unemployment. At any time, young people are 3 times more likely than the older population to be unemployed, and young people will be doubly disadvantaged when jobs do open up again due to older, more experienced workers being preferentially employed. The combination of loss of learning with loss of earning potential in the context of wider losses to family livelihoods, let alone social disconnections and potential grief, will exacerbate exclusion and inequality and provide particular additional risks for girls, people with disabilities, and other already marginalised groups. For mental health, this is not a pretty picture. Which brings us to thinking about the potential duration of impacts. This slide is a simple schema that aims to highlight that while it is the elderly who've been most affected during the first wave of the pandemic, harms to young people's mental health and the scarring to their future education and employment will continue to grow the longer the pandemic continues. We need to be considering preventive interventions now, including maximising flexible opportunities for learning and supporting early return to school as soon as it is safe to do so. Before the pandemic, again, at the best of times and in the most resourced of places, there was a major mental health gap, which many different elements contribute to, as has been shown here. I want to particularly highlight the importance of addressing stigma as a barrier to accessing healthcare for most mental health conditions, although clearly in many parts of the world, the absence of trained providers is equally immense. This same gap is also true for young people in relation to access to care. But a time of crisis, therefore, needs to spur us to think about how we, if you like, build back better. Many innovative approaches are being developed around engaging with young people about their experiences of coping with distress at this time. And we'll be hearing more about this from Omnia and Joanna, as well as some resources to address this from Tarun. We need to think harder about how to support families and build pathways to young people's engagement in their communities, which brings us to the importance of schools, not just as places of learning, but arguably as centres of well-being. But we also need to recognise that there are pluses and minuses, both of face-to-face learning as well as virtual learning, as Colleen will be highlighting. Many of us as health professionals may also need to think about how our roles can be extended in order that we can provide greater support to families, children and young people around dealing with stress and common mental disorders. Too often, nurses, general practitioners and paediatricians view mental health conditions as the sole domain of specialist mental health conditions, of specialist mental health professionals, rather than as something that we might also be responsible for. Yet, as I've tried to show here, what comes around goes around. Many of us as health professionals have a good appreciation of why chronic physical health conditions are associated with double the odds of comorbid mental disorders such as depression and anxiety. But I think we're less good at appreciating that the physical health and developmental comorbidities of common mental health disorders accumulate early across the life course, which is also something that we can do something about. These are, if you like, two sides of the same coin. And I'd like to argue that addressing mental health, preventing mental health, responding to mental health is everybody's business. Many of us as professionals would benefit from more training around identifying and responding to common mental disorders, however. In conclusion, COVID-19 is having a huge impact on the balance of risk and protective factors for mental disorders in the young. Mental health conditions are already common in children and young people, and the many ways in which the pandemic is affecting relationships, contexts, and environment will only increase further. As a community, we need to learn the lessons of this in relation to prevention and start to think differently about developing models of care for common mental disorder. Managing these conditions, as I said before, is everyone's business. But to conclude, as Henrietta Fore from UNICEF said, as a community, we must make it okay to talk about mental health. We must invite young people to share their concerns with us, as well as their ideas about how to build back better. Thank you, and I'd like to now hand over to Omnia and Joanna for the next presentation.
Thank you so much, Susan, for that very useful overview. My name is Joanna, and just like to start by saying that as part of our work at UNICEF, it has been very important for us to ask and also listen to young people directly about how COVID has impacted their well-being. And there have been really three key mechanisms for us to do so during this time. Omnia, if you don't mind pushing to the next slide. Thank you. First, we have a platform called YouReport, which is basically a social messaging tool and a data collection system that allows us to communicate with young people through Facebook Messenger, SMS, WhatsApp, and Viber. To date, we have over 10 million users who are registered across 67 low and middle income countries. And since February of this year, we've launched a YouReport chatbot to support COVID risk communication, where we've had over 6.5 million interactions to date. Secondly, a critical source of information for us has been through the data that's shared through our partners and our youth networks, especially when it comes to connecting with and reaching and hearing from segments of the population who are offline, or those who may be in particularly vulnerable situations, such as those living with disabilities, refugees, the LGBTI community, Indigenous youth, or young caregivers. And lastly, we've been engaging with young people globally through a variety of live chats online, similar, to how we're doing now, but through different platforms, which provides a space for open discussion and hearing from them directly. Our regional and country offices run these kind of open spaces locally, and at the global level, we've been partnering with the Youth Envoy and WHO to host a session every other week called Coping with COVID. So these are kind of the primary ways we've been interacting and engaging with young people and hearing from them directly about what the major sources of change, how they're being impacted in mental well-being and mental health, and what are the key asks that they have as well. So now I'd like to hand it to Amia, who will share a little bit about actually what young people have been saying to us.
Thank you, Joanna. So now I'm here to share with you more from specific examples from youth who have shared their concerns, their feelings with us through the number of surveys that were conducted by UNICEF. So first of all, to really focus on a specific group of young people from Kenya, they were asked about how they felt most once the COVID-19 measures were implemented. And as you can see in the graph, that 72%, a huge number of them shared that they had mostly negative feelings that were chiefly led by sadness, loneliness, and abandonment, fear, but also shock and surprise at the level and the strict implementation of such measures by over 100 countries from all over the world. And at the same time, we can also see that still 26% of them, which is still a considerable percentage, reported positive feelings of hope and anticipation of what is yet to come post-COVID. And then to go on from a more global perspective, and really focusing on the feelings of fear and anxiety, another global survey that was conducted by UNICEF showed that youth and young people from around the world, around 80% of them, said that they are still have a fear and anxiety towards returning back to school, and that there might be suspected infections when school resumes again. And then focusing more from a regional perspective, and specifically to Latin America and the Caribbean region, around 44% of the respondents, of the young people, really showed that fear was due to a lack of knowledge and not knowing how they can protect themselves. And only a third of them answered correctly how COVID-19 spread. So they also lack the understanding and the knowledge of how to prevent and protect themselves from the virus. And then finally, going back to Kenya, they reported that fear and that anxiety, around 38% of them, were really fearful from the future, from the economic decline that all the media, all the countries and the governments are talking about due to the strict measures that were implemented during COVID. But then it's not just the fear and the anxiety of all of these external factors, it also comes from the isolation, both on a physical and on a digital level. So as you have seen, that confinement measures have really impacted the mental health and well-being of youth because they are now physically isolated in their homes, as well as not being able to go to their schools or universities and so on. And at the same time, due to the economic impact and the financial implications of COVID and the decreased incomes, many of the young people cannot afford to continuously update their data bundles, which leaves them digitally isolated from even the online and the virtual platforms that is available worldwide. And then to really reflect on, personal stories of what youth has been sharing with us. You can see that, for example, Daniela, she's a 13-year-old girl from El Salvador, and she said that when I first heard about school closures due to coronavirus, I felt stressed because I wouldn't be able to see my friends, and because it's harder to learn when you don't have a teacher right in front of you. And then from the other side of the world, we have Mustafa from Iraq. He's a 19-year-old boy, and he said that this will be an exceptional year for every student. And the first feelings that come to mind are frustration and tension, but I have to overcome them. So now Joanna is going to share with you what their needs, what are they asking to do, and I'm going to transfer it back to Joanna.
Thank you so much, Omnia. Yeah, and three of the key asks that I would like to highlight here that we've been hearing from young people. The first has been for more safe spaces where they can talk about how they're feeling, what they're going through. They also expressed the need to feel heard, for their mental health needs to be validated, and importantly for the normalization of health-seeking behavior. We've heard, for example, that while young people it's common or it's feasible for them to get excused absence for school or for work, for physical illness. This is rarely the case when it comes to feeling mentally unwell. Or from young caregivers, they may get community support or parental support when in childcare if they have to go to work or go to school. But if it was to take a break or to get space for just self-care or meeting their mental health needs, that usually isn't something that they would be able to ask for. So the need to, as what Susan Sawyer's last slide ended off, the need for being able to talk about mental health and well-being and for being able to ask for help when they need it are both things that young people have felt are really important. They've also asked for opportunities to learn, from mental health literacy to skills for self-care, for when and how they can get help if they need it, and even about how to be a good friend or how to be a supportive friend to those who are going through difficult times. These are all topics and things that they mentioned the need to learn more about. And lastly, many of them have asked for free access to mental health support, whether that's online, through school, or mobile devices from peers and also from professionals. These are different ways that they have expressed they would be looking to seek for help. So when we look at some of the challenges that Omnia has highlighted, we see that COVID is elevating both new, I think Anshu also mentioned this, both new and existing needs for mental health support among young people. And there are opportunities for us to also better equip them to take care of their mental well-being and also handle stress. There are three key opportunities that we see from what young people are talking about. One is that in these disruptions to normal life, that's meant universally that young people have to adapt, have to find new ways of doing things. And this may be an opportunity for us, to really support them in building resiliency and also strengthening specifically their problem solving skills and giving them the confidence and the ability to face difficult challenges. As they're also faced with increasing fear and anxiety and negative emotions, like sadness as well. This is also an opportunity to give them tools for managing stress and also regulating their emotions. And lastly, as there are these increased feelings of isolation and loneliness due to confinement measures, we can also encourage them to strengthen healthy social connections in new ways and work on building their interpersonal skills, whether it's with family or people they're living with or their friends. So I think, as Susan pointed out, pediatricians play such an important role, not only in supporting young people to access mental health care when they are in need of treatment, but also in promoting the idea that young people um, and also their parents have actions to take in maintaining positive mental well-being. Just as we would for physical health, we would take care of ourselves and be proactive to take care of ourselves mentally, and also the interconnections between physical health and mental health. Those are some things that pediatricians can really help to highlight and bring attention to. So thank you for this opportunity, and I'd like to pass it to Colleen now.
Good morning from Los Angeles, and
Colin,
well,
please turn on your video.
and we're going to talk a little bit about what this looks like in the clinical scenario.
Colleen, please put your video on. Thank you.
Okay, no, it's on now, I believe. So, so let's get started in talking about some of the kids and what are the challenges that we see clinically. So I'm going to start off with Alex. Alex is one of your patients who already has ADHD and anxiety disorder. And he's generally anxious because he's the class clown at school, but he worries about his parents and what the consequences are going to be for poor grades and for poor behavioral health at school. And at the same time, he worries about what his friends are going to think about him if he doesn't act like the class clown. This is a pretty typical situation when you have a child and an adolescent with ADHD and anxiety. Well, what has COVID-19 done with Alex? He can actually attend school virtually, and he can focus on his work without having to draw attention to himself. But at the same time, he can meet with his friends virtually. So he can separate out his work and his friends because he's got access to broadband internet. He's got access to a good online school platform. And he can be successful with his school during the day, making his parents happy, and he can be himself with his friends. This is the good of what we're seeing with COVID-19 and mental health. We have some of our kids who are actually thriving during this time because they have problems with anxiety, and they have problems with inattention, and they have problems with school anxiety. And what we're learning is that this actually could become a good, successful platform for some of our kids. So how do we help out and support kids who are like Alex? Continue that option of virtual classes as schools begin to open up, and have the option for some of the classes to be taken online or be taken virtually. One of the ideas is offering now school-based behavioral health services virtually as well too, because when you look at Alex, you could work with him and say, what's helping and what isn't helping? And what are you finding out from this situation to have the insight to be applied to other situations? What is it that has made you anxious, and why is it that you're successful now? And how can you partner with that team to make small changes so that you can take your success and move it into other areas of your life? This could happen through school-based behavioral health services. And many of us who are actually seeing kids right now and are caring for them virtually are finding that a lot of the teens are opening up for us virtually in ways that they didn't do face-to-face. So this could become what Joanna and Omnia have talked about as that safe space for these adolescents. But at the same time, supporting these kids doesn't mean cutting them off from everybody else. there should be some in-person classes and activities that help with socialization, because we know some of these kids would stay away from everybody if they were given the choice. But let's open up a safe space outside, whether it is in a sports activity or choir or band or theater or something where they can actually come out and socialize. And when you have that child who is adverse to doing the socializing because they're anxious, work with them through that platform in school-based behavioral services to be able to say, okay, I'm going to try going to band class one day or choir one day. Well, how about the kids that are having trouble? And we have a lot of kids who are having trouble this time, and Keyshia is one of them. She's a good student. She has lots of friends at school. She has several close friends, and she's involved in activities like basketball and like band. And we've seen this happen to kids during COVID-19 as well, too. She's attending online school and doing okay with it, but what's happened is her grandmother was hospitalized with COVID-19 for 3 weeks. One of the impacts that we haven't discussed, but is really important to discuss, are our teens out there who have had family members who have been struck by COVID-19, where the teen themselves might not have gotten particularly sick. Many of our teens have had parents and grandparents and other adults that are close to them become very ill with COVID-19 or have died from it. And because of this, her grades are dropping. She doesn't have the social support at school. She doesn't have some of the academic support at school, and there's stress going on in her family. So she's actually started to have episodes of chest pain, and she's been to the emergency department twice with her chest pain. And they've told her that this is anxiety, but she's had difficulty sleeping, and overall, she hasn't felt like herself and hasn't wanted to virtually meet with her friends. So this becomes a vicious cycle of going downward, of anxiety, not feeling that she's effective, not wanting to be that person with her friends, and being worried. So how do we support Keyshia? When we reach out to kids like Keyshia, recognize what her losses are, first of all, during this time. She's had family member illness. She's had her separation from her friends, and she feels like a different person. She feels like she's not an effective person, and that plays into everything and every interaction that she has. This is where cognitive training and problem solving on what can be done could help out patients like Keyshia. And again, through a school-based virtual platform, or with our healthcare workers and mental health workers in virtual platforms, we can talk to Keyshia and help her build the skills on what can she do to connect with her grandmother who's ill. What can she do to meet up with one of her good friends who might really be caring about her and wondering what's going on with her, to do a fun activity? What can she do right now to reset her own school expectations and address her perfectionism? That one of the things we're talking to our kids about a lot right now is that you're not going to do as well in school than you did before this happened, because it's difficult to change all of a sudden to an online platform. So let's reset those expectations and let's figure out what's going to be good enough for you right now. Prioritize the things you have to do, but let some of the other things slide and be okay with it, because we want to build resilience overall. And in each of these, try one intervention to keep Keyshia safe during physical distancing. And finally, my patients Genesis and Grace. They are in 4th and 5th grade. They're good students. They live in a 2-bedroom apartment that's crowded. Their parents are there. Their aunt and uncle live with them. They're a very close-knit family, but these are kids who live below the poverty level. And school is a place where they get a lot of their meals. They get free breakfast and lunch at school. These are the kids where we have the example of the ugly and the awful things that have happened during COVID-19 for these children. These children have had more than one family member die from COVID-19. And this is something that we're seeing in our practices with our very underserved kids. These are the kids where the family members are the most effective and they're losing family members. Their mother and their aunt became very ill, but they recovered. But now their mother and their aunt are the breadwinners for the family, and they're out doing domestic work for money. And so these children, who they themselves did not get particularly physically ill, are spending their days at home alone. Food is scarce. Schools don't have the resources that they need to teach them. And this is really the ugly of COVID-19, and it happens for our kids who are underserved, our kids living in poverty. The burden of COVID-19 is on these kids. These are the kids who are seeing their family members get sick and die. They're seeing their families totally disrupted by this. They're seeing family members who've not had to go out and work before have to get jobs. And many of them are alone. There's more death and disability. There's more loss for these children. And then there's the loss of school as that safe place, that safe space that we were talking about for learning and for food and for socializing. Children are home alone at much younger ages due to parental death, due to disability, and due to need for work. We have had several of our children in Los Angeles have to go into temporary foster care situations because their parent has been hospitalized and they have no one to care for them. And so this is really inducing that separation, that trauma to these children, on top of living on poverty and being disadvantaged. Food insecurity is a real problem for these kids and their families. And inequity in educational resources, as well as inequity in things like broadband internet. So you take a kid like Alex, and he's got good school resources and good broadband internet, but Genesis and Grace don't have that. And so even in the same country and in the same city, and kids who come to the same pediatrician, there's this inequity. And finally, we're seeing increasing reports of accidents. We're seeing increasing burns from children who are trying to cook for a younger sibling. We're seeing increasing accidents from kids just being unsupervised. We are sadly seeing more domestic violence in families, and we're seeing more child abuse in families. So this is the ugly, and this is the place where we as pediatricians need to start to put on our advocacy and look for solutions that could really help out these kids. Schools are looking at what should we be doing to open up. And this is where our voice could be heard in supporting Genesis and Grace. We need policies to support these struggling families because school becomes a hub for these kids. How could that help them out? Well, we could actually provide backpacks with food for home. We could be using school as that hub for home delivery of food. We could repurpose some of the funding that goes to schools that are not in session right now, that are not having the kids come in there, and provide broadband internet access. There are places in the United States that have done this, where they have been the hub and they've provided broadband internet access for the kids living within a 10 to 15 mile radius of the school. This is absolutely doable, and this could open up the world for a lot of these kids. Having these children rotate on site as much as possible, much as what's been talking about in opening up schools, is the fact that we can't have everybody there at the same time, everybody in the cafeteria, everybody on the playground, but that we could rotate and have some kids there at some point in time and other kids at other times. But this is really important for this particular group of kids because school is their safety net. And then one other innovative idea, these families where someone has died or somebody has become disabled from COVID-19, and you have a new adult who's not been in the workforce, hire them. Hire them to provide childcare for some younger children. Hire them to provide some of the activities or help out with art or with music or physical education. Hire them to do some of the cooking in school and prepare those meals that can then be sent home. So these are all really, really important ideas that are not things that we do in our office, but these are things that we advocate in our communities and advocate in our legislatures and in our countries to provide for the kids who've been most affected by COVID-19 to help their mental health. Tips for families. What I tell all of my families is that you are not going to be as productive now as you were before COVID-19, but your lesson is in resilience. So keep your routines, But understand that flexibility is crucial. Many of my adolescents who were used to getting up to go to school in the morning are now sleeping till noon, which is probably not a bad thing for them. But to understand that there's got to be some structure with sleep and with meals, there's got to be active time, there's got to be interactive time. And in this, there can be new routines and new memories. Reading. Some of my adolescents who are not particularly strong in school have started reading with their parents. And their parents will read some, the adolescent would read some. And we think about this as an activity for younger children, but my adolescents are beginning to enjoy this actually. Meal prep and cleaning. Again, reading, one of the best ways to read is to read a cookbook, read a recipe, do something with that reading that is going to promote something positive like a meal or getting together and interacting with your family. And I have my families ask their kids and their adolescents about what was the one good thing about today. These are all activities that just help to build resilience. Because in COVID-19, we've seen a lot of loss, but there are some silver linings. The silver lining for mental health in adolescence is that we're actually finding better ways to connect with some of our adolescents who've had pre-existing mental health problems. We're finding that we have ways to help to get our kids to cope and build resilience when they've come across some of the difficulties. And we're seeing some very innovative ways to help kids who have been devastated by COVID-19 by using school as hubs, by using school to help promote behavioral health and maybe actually work with some of our kids who have behavioral health problems. So let's look at some of the silver linings. Let's put on our individual pediatric hats, what we're able to do with our kids in practice and what we're able to advocate on a greater scale. And with that, I will say thank you.
So, hi, I think this is a cue for me to start my
yes.
Okay, here I go. So thanks very much to the speakers. So coming last, it's bringing all of these different threads together. So we heard about the importance of adolescent mental health in the times of COVID-19. We heard that what should be done, what can be done, excellent presentations by Susan, Joanna, Omnia, and Colleen. And this is all women power coming here. And so I'm going to talk about what is being done, what support and guidance is available, and what's the direction this community should be looking at. So we have looked at the facts and figures, and just two things I would like you to remember, that we talked about the school closures that are happening. And if we think about the numbers that are being impacted, it's huge. 1.6 billion learners are affected by national closures. We know there is a percentage of children who do not have access to schools, but this is a huge numbers we are talking about. We heard about all the facts and figures in terms of that, what adolescents are going through, the anxiety and depression. The data that is coming from China, from UK, from Italy, from Spain, all of this data is showing that around 30 to 40% of the youth are going to have some kind of psychological problems. And this is much more beyond that what you would normally see. So we are talking about 1 in 3 adolescents being impacted. And it does make sense that as we think about our policies, our practices, that we take into account how these problems, they are going to be problems, how they can be prevented, how they can be better managed, because we heard about the potential increase in suicidal attempts that might be happening, some deaths might be happening, and the long-term consequences, and how the community, this community can help in undertaking some of these actions. Now, the mental health and psychosocial support is integral to the public health COVID response. Until now, when we have been talking about mental health and psychosocial support, it has been mainly in context of some of these humanitarian emergencies like earthquake or other disasters. But this pandemic has said that it is important across all the countries. And there are 3 action points that were put in the policy brief that was put out by the UN Secretary General. One being that we need a whole of society approach to promote, protect, and care for mental health. The second is that we need widespread availability of emergency mental health and psychosocial support for people who need it. So think about this as you are organizing your COVID-19 clinical services. You need to organize your emergency mental health and psychosocial support services. It's not something that's going to come afterwards. It's something that has to be part of your organization. And then it has to be part of building back better that Susan talked about, is that we need to build mental health services for the future. So these are three action points that the countries, the clinicians, all of us should be taking. And we will be judged by how, when, what kind of action we have taken against each of these 3 bullet points. So, you know, we talk about COVID-19, and the infection prevention and control is the first thing that comes to our mind. The second thing that comes to our mind is older people and other at-risk people. We are talking about mental health and psychosocial support. It is being talked about, but are we doing sufficient? Are we doing sufficient for adolescents? And then I think very nicely put by Joanna, that how do we change challenge into opportunity? This is a new normal situation of COVID-19 that we are going to live in. And what are we going to do for mental health? There are lots of resources that have been put together. These are just summary information, you know, from WHO website. There are many more available. So for example, there are resources that have been put out for managing stress. There are resources for violence. There are resources for other mental health issues. There are question and answers. There are this book, My Hero Is You, for 6 to 11-year-old, but it does talk about for younger adolescents to making them understand. So we heard about that to need to provide facts and figures, and I think there are plenty of them that are available. There are these new set of infographics that are going to come out very soon by Interagency Standing Committee on Mental Health and Psychosocial Support, which organizes the humanitarian response. So these are some of the things that you can take, translate, adapt, use it in different languages, different countries. Then we have also a set of resources for parents, teachers, and schools. So for example, we talked about the role of the families and the parenting, and quite a bit of information that is available and that can be disseminated. For schools, there is a framework for reopening schools. What are the implications for protecting children online? So quite a bit is available. Now, the question that comes in are, how are these, having the resources, one thing, and the second thing is that how is it being used at a country level? I think that's the most important thing that we need to think about. When we talk about the emergency mental health and psychosocial support, it's important that there is going to be disruption of services, and how do we maintain essential health services? So there is a excellent guidance that is available on from WHO on COVID-19 context and how these services can be maintained, how do we transition, what health workers can do to help women survivors of violence. So then also about the basic psychosocial support for a guide for COVID-19 responders. I also wanted to bring in that some of our young people are actually doctors, and they are going to be frontline responders, and we need to think about their mental health as well. So all of this has to be part of the mental health and psychosocial support response when things are being organized at a national level, at a hospital level, or at a clinic level, or at a community level. So there are different kinds of resources that are available. And there are, these are some of the examples that I could just fit on one slide. For example, I talked about this, the book, the My Hero Is You book, for example. This is being translated now in 111 languages. That's amazing. To put it in context, there is in terms of top translated books, and Bible tops the list with 3,000 translations. This is in 111 is around Adventures of Asterix, which is 115. So it's doing very well. It's in the top 10. We have also helpline established in numerous countries, online peer support that has been organized. So many of these activities are being undertaken by mental health community within the countries, also being taken by the adolescent health specialists, by other people. But in terms of, I think, moving forward, there are 4 considerations that I would like to think, and I would propose for the group to think forward. One is in terms of when we are thinking about these resources. Are they in the format that the adolescents are looking for? We heard some of these from the presentation from Joanna. Are we doing sufficiently for disseminate that? And the part about the infodemic, and I'm going to come back to this point a little later. The second is that we need to think about promotion and prevention, and Colleen talked about the role the schools can play, the policies that they can have, and how do we use these schools as a platform for promoting mental health. The third part is that we do know that 1/3 of adolescents will have problems. Then how do we offer essential mental health services when things are getting disrupted? So what's the role of telehealth? And on what is going to be the long-term impact of COVID-19 on adolescent mental health. So these are the 4 points, and I have a slide on each of them. So we know that we need to provide facts and figures, but we also know the infodemic, the misinformation, the disinformation that is currently being available, the fake news, and all of that actually compounds and leads to increase in the mental illness. And this is very important because this is spreading faster than the virus. And an important role to play that as we think about good resources for adolescents and they get most of their information from digital media, social media, that we have mythbusters to go in parallel. We have to display these myths and misinformation if we have to support adolescents. So I think that's one thing going forward we have to do about it. These are some of the links from WHO, UNICEF, there are others. There are many, many of those sources. And I think it's about how do we say that adolescents can get all of this information that is required, and how do we act as good mythbusters? That was point number 2. I talked about the role of promotion and prevention at a school level. And I just wanted to say that this is something that we need to think about moving forward. Use this convert this into an opportunity of having a good promotion and prevention program. And this is a Helping Adolescent Thrive toolkit for promoting mental health, preventing mental health conditions, and reducing risk behavior and self-harm. These are based on evidence-based guidelines. WHO together with UNICEF is going to launch it shortly. So I think this is the kind of a thing that we require each of the countries to be picking up, focusing on promotion and prevention through communities, through schools, and using some of the digital platforms, because I think that's going to be our new normal way of disseminating many of this information. The third point is about maintaining essential health services. How do we do that? There has been survey done on non-communicable disease services, and approximately 30 to 50% services have been disrupted. They will be likely similar for mental health. A rapid assessment survey is being undertaken by WHO. We are looking at outpatient and some inpatient services for children and adolescents with disabilities. And this is a community that gets forgotten sometimes. Looking at the school mental health programs, what's happening. We also know that there's a lack of specialized workforce in low and middle income countries. So very often it comes in, okay, talk about telehealth, digital health, but are these being evidence informed? I have been looking at the issues like the training requirements, the policy changes, the reimbursement schemes. The important point about the digital divide and data security issues. How are we doing? Are we doing sufficiently? And also thinking about this age group in mind. And so I think that has to be part of our thinking and our policy evolution going forward, and the service delivery platforms as we think about these issues related to mental health. And I think this is about the implementation science that can help us in answering many of these questions. The last point that I wanted to bring is that having data on impact on adolescent brain and mental health. And there have been some initiatives, for example, CoSpace and Related have been started in various countries where they're looking at what is the impact, what parents are doing, what adolescents are doing, what are going to be the coping strategies. Some of these results are getting out, so some of these are available. So that's interesting. There are some studies which are looking at adolescents with existing mental health problems and neurodevelopmental disorders and the disruption and what is going to be the impact on them. And I think that's extremely important. We should not forget about it. And Colleen did pick on that. But I think moving forward, as we think about these long-term consequences, and this is not in the next 6 months or so, it's beyond that, because we know that the brain is growing, still growing in that period. And we need to see what's going to be the long-term impact on these consequences. What is very, very important is to think about in terms of, can we have a harmonized protocol? Because then this will help us in bringing all the different data set together. One of the article I was reading, and I like the fact, and if you look at the list of the risk factors that Susan talked about, is risk factors accumulate like under a burning glass in the pandemic. So at one point in time, we talk about the economic impact and the social isolation that is happening, and how do you weigh that? We know this is not going to be the only wave. It's going to be some time. It's going to be a long return to normality, and the information is needed so that we can think about planning in terms of seeing that in this new phase, what can we do better? And the role the society has to play, the role clinicians have to play, the role policymakers has to play. Adolescent mental health has to be part of that framework. So with this, I end my presentation and I hand it back to Anshu and Susan. Thank you.
Susan, you're on mute, I think.
Susan, you are muted.
Is that any better?
Yes.
Okay, I'll try. I don't know what happened there. Thank you to all of our speakers, and we've now got half an hour, and there have been a number of questions that have come through. A couple of the first ones are to me, so I might actually start off by them and then we'll circulate them. Our speakers can all see these, so also please feel free to put up your hands if you feel that one of these would be particularly valuable for you. So the first one was, are there reasons to believe that adolescent mental health was already worsening prior to COVID-19? And what we think the influence of social media might be, and how might internet support, or how might access to the internet support or worsen adolescent mental health, which I think is a terrific question. I mean, the challenge is, this is sort of a bit of a million-dollar question. I think, many of us believe that adolescent mental health is getting much worse, but in the absence of repeat cross-sectional surveys using the same measures, there's actually remarkably little data that we have about that. In some areas, for example, in anorexia nervosa, there's actually no evidence of any major change in prevalence at all. What is clear, however, though, is that there is much greater presentation of young people with mental health conditions that may as likely reflect improved mental health literacy, improved access to care, reducing stigma, different community understandings, perceptions. So it's a really fraught space. Having said that, there is also data that would suggest that young people who spend the most time on social media and on the internet have got the poorest mental health. And given the changes that we've seen in relationship to engagement with social media, I think we can anticipate that that is certainly a risk, notwithstanding the fact that, like with a lot of social determinants, there are both risks and benefits in terms of greater connectivity. And then I'm going to jump to the second question, which is also on data, and then hand over to some of the other speakers, because the next question is, do we have data on violence against children? We do have some data on violence against children. So the Global School Health Survey has got some, but it's pretty limited. It's really only addressed at 13 to 17-year-olds. It's not around the scope of violence that we might wish. And we have a remarkable absence of data in younger children about anything, to be honest. We've got good data on under 5-year-olds. We have very poor data on 5 to 9-year-olds, and also pretty poor data on 10 to 14-year-olds. So, my sense is that, as I mentioned in my study, that adolescent mental health, substance use, violence are areas that I think the world if there is perhaps another silver lining to the COVID-19 pandemic, to use Colleen's language, I think that we can no longer ignore mental health in our community, and I think that we are going to have to grapple with this, not just as high-income countries have started to do over the last few decades, but more broadly. Okay, next question is, how can we implement interventions to help the most isolated youth, those without access to the internet? Are any of our speakers keen to take that? Would you like to just raise your hand for me? Omnia, is that something,
Yeah,
or
Omnia.
Joanna? Omnia, why don't you start?
Omnia can start, yep.
Yep.
Yeah, thank you, Suzanne. So what I wanted to share is that, for example, in my organization, the IFMSA, which is the Federation of Medical Students, many of us in many different countries have worked and did a lot of volunteering and building awareness and capacity building, especially with COVID to young people, because many of us have that unique and outreach to our community. So many medical students in Morocco, in Iraq, and also Europe, as Portugal, and many of us have reported these activities, and we also have them in an interactive map on our IFMSA website. And it shows that they have really did direct contact with youth as well as many other individuals in the community, and raised awareness on simply how to protect themselves, what to do, busting the widespread of misinformation, but doing it on a one-on-one personal level, because we understand that we do a lot of messaging online, but we still wanted to reach those who are offline. But Joanna can also talk more about that.
No, I was just going to add that, for us, that is a very, young people themselves are a key resource for that. Of course, we have local radio, we have print materials, and those are sometimes ways. We have community health workers, those are some ways. But oftentimes we found that young people themselves who are in communities, they serve as that kind of bridge. Maybe one young person, for example, in a community has the phone who can send SMS, but a number of those around them do not. But they're established sort of as a point person, and young people will go to them. And that's really, for us as well, when we try to find out what are some of the challenges young people are facing, we have to go through, our youth networks who have the connection with people who are offline, who are maybe in vulnerable situations. So I would agree with Omnia. That is one way, not to say that we shouldn't work harder at, bridging, I think, the digital divide, because that is such a critical source still. And if we can somehow bridge that gap, young people need information, and that's going to put them at such a big disadvantage if they have that. So while we try to use these other mechanisms, I think ultimately it's very important for us to work with companies and people who can help us bridge that gap somehow.
Joanna, the fourth question is actually in relation to your presentation, whether the data are available. So could you say something about that?
Oh, yes. So there is a site, if you look, U-Report, UNICEF's U-Report, most of the polls that we run, they're actually live. The way U-Report is organized, there's global channel, and then by country, you can search U-Report like Nigeria, U-Report, specific countries that have running polls, and actually the polls are kept live, so you can watch as young people are responding as well. So most of the information I shared are there. Another place is voicesofyouth.org. That is a site where young people can post directly, and that's usually less in form of data points, but if you want more, how young people are expressing themselves, there's a lot of blogs or videos or artwork that you can see linked through there as well.
Okay. Susan, the next question is for you again. I just wanted to say something about violence against children. WHO issued a report last week on violence against children, highlighting that for children between 2 and 17 years of age, 1.2 billion children, 1 billion children actually experienced physical, sexual, or emotional violence in the past year. So there are some complementary data available. The question for you is whether there are findings that can describe youth coping mechanisms, especially during the pandemic.
I think it's a good question. I haven't seen sort of any formal studies on it. I think Omnia has spoken very nicely about the range of different coping mechanisms that various different young people are utilising, and many of those are trying to have social contact with their friends and have an opportunity to share and just engage with others who are experiencing the same challenges. The one point additionally that I would make, though, that hasn't come up, and that it was in the risk and protective factors for common mental disorder that I shared, which is the importance of physical activity as a protective factor against a wide range of mental disorders. Now, I hadn't appreciated that in Spain, for example, no one was allowed to go out of their houses at all, because in Australia, we certainly have been able to move outside of our houses to participate in physical activity. And I think regular physical activity is really, really important, not just for young people, but for all of us as adults as well. Omnia and Taryn.
Just a quick comment on what you said, because Joanna also mentioned there was a series that was done by WHO, UNICEF, and the UN Youth Envoy. It's called Coping with COVID. And in these webinars, there are many youth speakers who are sharing what they are doing in their coping mechanisms. I remember one of the session I was in, we had a yoga session facilitated by a young person from the Caribbean, and she was taking us onto how to, spend time doing that, as well as meditation and breathing exercises. So I really recommend going back to these webinars. They're all recorded, and even the presentations are shared, and it's all youth-led sharing, like what they are doing in their networks, but also in their own individual capacities.
Taryn?
Yeah, so just to add, one, I was going to say that there's some qualitative information that is available through those webinars. The other, I would say that I mentioned about some of the studies that are coming through, and I talked about the co-space work that is done in many countries, and there is data that is coming, what parents are doing, what adolescents are doing in terms of the coping strategies, what are they feeling and how. So all of that data has started to come in, and there is also one study from China. So some of these information is now trickling out, and based on these surveys, what they are trying to do is to say that to harmonize some of these surveys, and there are many others parenting surveys that are ongoing. But I think it's very important, and this is where we come to see that if we can harmonize and think in terms of a few variables, because ultimately that will help us and say that, okay, as we are designing our promotion and prevention programs, which are the strategies to focus on going forward in COVID.
And the additional point that I would be making is that, and one of my, we've all been, exposed to this huge barrage of studies, but the important consideration here is time and if you like, the intensity of the pandemic in different countries. And so the longer that the pandemic continues, the more we're getting second waves in different countries, the greater the challenges are going to be, and the sorts of coping strategies that might initially have worked quite reasonably, may no longer be sufficient as time goes on. So I feel that this is very much a watch this space. There's a question here that I feel that Colleen actually did cover pretty well, but there's two questions that I think are probably directed to you, Colleen. One is what suggestions can be given for kids and parents locked down inside the home, which you did touch upon, but perhaps to expand on that a little. And then the more specific question of, could you outline a little bit more about what advocacy actions that you might be recommending? How might we be able to tackle the social context of mental health?
Okay, well, thank you. I'm going to answer the second question first, because this is really an important role for us as pediatricians. It's one role where we might not be feeling comfortable at first. So advocacy is about addressing a problem, start locally, start with one school. That one school where your patients come from, where you've seen deaths in the family, where you've seen these kids staying at home. Contact the principal of the school. Have a Zoom meeting with them, talk about what you're seeing and what they're seeing, talk about some solutions, and see what things are doable. And then what you'll find is that they may say, I think the idea of sending home food to the family is great. Could you help us connect with a local food bank to do that? Or I think the idea of broadband internet is great, but you're going to need to talk to this person at the school board to redirect that funding. So then what you do is you go to the person at the school board and you make a Zoom meeting together with them and talk about what you're seeing with your kids. Remember, every one of you out there, everyone who's a pediatrician, you know more than 99.9% of more than what everybody else knows about child health and what children need. And your voice matters. So start talking with the people outside your office. Start with one school board member, one legislator, and you can start to get these ideas some traction and start to make some big changes on a bigger level for the kids. I think for the second, yes.
Yep, sorry, keep going.
For the second question, I think what I advise my families to do is, first and foremost, you're not going to be as productive as you were before COVID-19. Let's look at what are the important routines to continue and what are some new things that you could be doing. And again, focus on that one good thing about today that you can have parents and kids do together, because parents and kids have not spent the time together like they were doing during COVID-19. And it could cause conflict, certainly, but if you have activities that you do together, take a walk together, play basketball outside together, cook a meal together. These are things that can help to actually strengthen that parent-child relationship.
Colleen, while you're speaking, can I ask you to also address question 9 about what about excessive gaming hours, disruptive sleep, because we're certainly aware that these are pretty prevalent issues.
And again, this really speaks to routine and structure. So working with your teen and working with your adolescent and your preteen to talk about what's going to be school time, what's going to be outside time that we're going to do things, what are the times that we're going to be doing things together, like cooking, like cleaning up, like taking a walk. And then let's have 2 hours a day, that's our recommendation, where you're just free to do whatever. And that may be gaming, that may be interacting with your friends, but know that they're going to have that time every day. Structure your day though, so you have other activities going on that are not keeping kids on gaming the whole time. For those kids where parents have to work and have to be out of the home, it's a little bit harder, but those also tend to be the families that don't have access to the broadband internet and the games. So but you work with families to see what it is that you can do. Routines, active time, interactive time, and figure out one good thing about today.
Terrific.
Susan, I would like to add that both WHO and UNICEF have got this on their website, but we have a very nice, and it was also shown in Tarun's presentation, but we have very nice, let's say, one-pagers on parenting tips and looking at different kind of situations. So, you know, what do you do if someone gets angry in the house? What do you do for children with disability? What do you do, etc.? And so there's a whole series of those, and they're really very practical that people could look at and make use of. Tarun, there's a question for you, I think, which is on, do we have any preliminary findings on the potential impact of stress or shock due to the pandemic on brain development in children?
So right now there are no studies that are available from the COVID-19 pandemic because, you know, it's going to take some time. But what we know is the data that is available from the previous humanitarian emergencies, and where people have looked at brain development and the toxic stress and looking at the, you know, the impact that is on neurodevelopmental problems that might arise and going up to adolescence and later on even in adult life. So there are some studies, some data that is available and that we know of. And I think the question that one comes up is that when we think about these adverse experiences, the risk factors that Susan talked about, they are not going to be very different. And there is going to be accumulation of these risk factors, and it's going to be over a long time. And so I think that's why it is very important that we think from the point of preventing many of these problems to the onset to take place. So the focus on that, the prevention is very important rather than saying, okay, there is a problem and let's treat it. And I think that's something that I wanted to emphasize. I think this opportunity also to say the advocacy role that Colleen was talking about. And as a pediatrician or any policy maker, you are working with schools on having infection prevention and control, right? That's all the schools are working on. Why can't there be a parallel pillar of having a support to the mental health as part of infection prevention and control? As you think about infection prevention and control, think about the mental health of the schools, provide opportunities to parents. There are lots of those resources available. The problem is the government is not thinking about that right now. They're saying, okay, this is a problem that's going to come later. Let's focus on hand washing. But there are simple messages, and Colleen very nicely talked about that can be integrated into the programs. And that's I think we need to do today. There has to be that preparedness, and which is lacking in countries, unfortunately, across the world.
One of the interesting things I think that I'm increasingly seeing convergence around is the coming together of the health and education sectors. And to put in a plug for WHO and UNICEF and UNESCO in relationship to the work that's being done on the development of global standards for health promoting schools, because this is obviously a space where these are, if you like, Ministry of Education school policy around how, if you like, a focus on health and well-being can be mainstreamed, not simply in terms of health education and mental health literacy, as important as that is, but really in terms of a lot of broader ethos-driven and environmental contexts around schools and social relationships within a school community. So I think that, for the UN agencies involved in this work, it couldn't come at a better time, as I see it, for the appreciation and uptake with this. But we have a few more questions. I'm wondering about question 10 for Omnia or Joanna in terms of how can we counterbalance the negative impact of the anxiety generated via social media? Because there is a lot of anxiety that's generated. Some of that's good in terms of keeping kids locked out at home, at least initially, but obviously there are some downsides of that as well. Any thoughts on
that? So my thoughts, I have two things I wanted to share. The first of all is when it comes to social media, we always say that, the best recommendation is to try to decrease the use of social media, like WHO guidelines and so on. But the key thing, in my opinion, is providing alternatives to what to do rather than social media. Because now there are many options that you can do even at home in terms of, as I said, like physical exercise or reading a book or going back to the hobbies that you initially did not have the time to do, but now you can. I think it's important to reflect on how this time is really a time for us to, as young people, to reflect on what we wanted to do and what we plan to do, because we've been in such a rush of doing things all the time, running after our ambitions, our studies, and so on. But now we have the time to think back and reflect on what we want to do in life and ahead of our future, because I'm personally seeing it in the same way, like reflecting on what we have next. So this is also important in terms of providing alternatives. And at the same time, there are a diversity of youth-led initiatives and campaigns and sessions that are happening. Even like in our own network, we do a lot of trainings on a diversity of topics that we initially did not have the time to talk about, but now we do, getting in more experts to create these trainings and online sessions, building new soft skills as well as knowledge about diversity of topics. So rather than focusing on social media through Facebook, Twitter, and so on, but directing that into more, taking on courses that we wanted to do, and now we have the chance to do. There are many universities around the world providing free courses to take on. So these are my key, alternatives to the use of social media, and as well as, bonding again with the family and with our friends, even not physically, but also maintaining that social interaction that Joanna referred to, as well as I will leave to Joanna to elaborate on the Voices of Youth platform, because again, this is really a new way of, submitting in artistic pieces, as well as creating conversation, sharing emotions, and so on.
No, I mean, I think what Omnia said is great. And I think it's difficult to control what's on social media, but I think that's part of what Tarun was saying in the prevention activities and the promotion, really helping young people understand, because I think young people who are just born into this world where social media is around them don't always, especially the very younger ones who are just developmentally not at the stage to understand, what's real, what's not real. And also, how to manage and how to filter through the content, this really, really large volume of content they're receiving. I think, for the younger ones, parental control and parental support on all of these things are very important, but also for them to really just make those connections themselves. Wow, I'm getting a big headache. We've seen this in some of our sessions. I'm getting a headache. I'm always stressed. You know what? I think it's because I'm always reading news. I'm always seeing this information on Twitter. And so we've seen young people themselves say, or it's maybe not that, just receiving information, but the need to feel like you're keeping up. Even on WhatsApp groups, I'm on like 10 WhatsApp groups and I'm constantly feeling the need to talk to people. So we've seen a lot of young people make the connection themselves. Maybe I should stop. Maybe I should not do that right before I go to sleep because that makes me not sleep well. So I think it's really, we have to empower young people to understand, these things that are having an impact on them, help them make the connections, and also, really work with them to come up with solutions and things that they can monitor that level of anxiety, understand what anxiety might feel like, what are the reasons for it, and what I might do to make that different.
And do you think we've got time for one last question?
Yes, I was wondering, because there are a couple of questions about, what Omnia was mentioning, I think, about what else could you do? What are the options? So someone is talking about, can we increase resilience and find meaning in life? Someone else is talking about spirituality as a kind of conduct or a different channel, but at the same time, also looking at increase in suicide rates and how could we prevent that? And also, what do we do, particularly in low middle income countries, like in DRC, for example, and how do we help people there who maybe do not have, broadband access, etc. And what are the options there to channel, let's say, the attention space of adolescents to do other things that are constructive? Omnia, go ahead.
Just one thing I wanted to really highlight, which many young people reported that it tremendously helped their mental health, which is helping others. So even if those who do not have access to internet, or regardless of all the barriers, really one thing that really boosted their mental health is the way that, taking on initiatives to help others, either through awareness or, spreading the right information, spreading tips and tricks on what to do, even not specifically for COVID, but for anything, in life in general during these special times. But at the same time, by volunteering and working, with either those who do not have access to medication or access to food, or even helping your older family members who cannot, who need your help to maybe go to the supermarket and buy something for them, or also working in volunteering as our young medical students who now do not work in the hospital, but sometimes they just go and volunteer to help those who are COVID patients affected, and helping them with simple things and not necessarily have the medical background for it. But also, like, as young people, we have a lot of energy and we have a lot of motivation to do things, and when we help others, this really helps our mental health.
I mean, it does seem to me that there are two population groups that have been relatively invisible in many countries. One is the elderly, and one is children and young people. And for different reasons, it does seem to me that both of these population groups have become much more visible to us. And I think the opportunities, as Omnia, you've just beautifully outlined, the opportunities of really appreciating the amazing capacities of young people, not just to be recipients, but actually to be contributing to their communities and to be appreciated for the value that they can add, rather than the other way around. So I think that's a pretty nice space for us all to end. Anshu, over to you.
Thanks. And I think we're coming to the end of this seminar. So I don't know whether anyone would like to comment on anything else, or comment on anything that we've been discussing. Any final comments? In that case, I think from my side, I'd really like to thank the organizers for this seminar. I think it was a very crucial topic to discuss. I hope that we'll be able to provide follow-up support as well, so that anyone who would like to have questions answered or access to materials, etc., can write, and we will be able to see how we can get those materials to you. And that's from my side. Susan, from your side?
No, I think I'm done. I just want to add my thanks to the organisers for getting us here, particularly to our colleagues in India for getting us here on time. To those of you at home and at work around the world, I wish you a good day. And to our colleagues, particularly on the front lines, hang in there, keep up your great work. And for all of us, remember to smell the roses and keep up the yoga classes.
Well, thank you again on behalf of IPA, both Anshu and Susan and all of the panelists. We really appreciate your time at the various times around the world that we've been in today. I want to just remind folks the webinar will be archived on the YouTube channel and will be available for people to view afterward if you'd like to share it with colleagues or go back to parts of it. And we've asked the speakers to make their presentations available as well, and we'll have that posted on the IPA website as well. This is part of a series of webinars. That's one of the activities in a partnership between IPA, UNICEF, and the WHO. And we'll have upcoming webinars in July, both in the Spanish and French version of the Adolescent and Mental Health one, as well as on Do No Harm in Newborn and Perinatal Care, and separately on a deeper dive into the school opening and children's health issues in English. We also will have the first of a joint issue brief coming out on multi-organ inflammatory syndrome and severe COVID presentation in children. I want to thank the Planning Committee for the partnership, both Dr. Banerjee and Wilson Ware from WHO, Gagan Gupta and Stefan Peterson from UNICEF, and Zulfi Buddha and myself on behalf of IPA. And again, thanks to Dr. Thacker and the IPA staff for their support for all of these activities. Again, please subscribe to the YouTube channel for notices about upcoming webinars. And thank you again for joining us today.